we cannot really talk about documentation without really addressing some misnomers, right?
Yes.
So there's the idea that information. So for example, we know that there's 4 diagnosis codes that are covered for
Right.
lymphedema compression items, right? The idea that the diagnosis code written on the order is going to be enough is just straight fallacy, right?
Yep.
We know that the information has to be corroborated by the medical record. So if you only have the diagnosis code written on the prescription, but it's not memorialized within the medical records, these are basic tenets.
Yeah.
But these are some of the questions that I've been asked because a lot of the folks that are in this space are new to the whole DME post, right? So
Right.
just for clarity, if the
Yes.
if the ICD-10 is documented on the prescription, but not in the medical records, then that would not be able to withstand the scrutiny of any auditing entity on the Medicare fee-for-service.
Yeah, and
So
that's not
just
going to
wanted
work.
to dispel that because, yeah, it's probably one of the common questions that I've been asked. If you don't bill one of these codes, of course, the claims are going to deny as not reasonable and necessary. But when you bill that, Medicare is expecting that your medical records is going to reflect one of the 4 diagnosis codes. So just wanted to throw that out there while we're talking about documentation.
Absolutely. I'm glad you did. Medical necessity belongs in the medical record, and that includes the diagnosis. And technically, if we're dealing with Medicare fee-for-service, a diagnosis is not required on the order. They look for it in the medical record.
Great.
And physicians
Agreed.
and practitioners should be putting that in there. If they're treating the patients for this condition or any condition, they're not putting in there, shame on them. I'd honestly find a new physician. Right.